This is Rachel. She is building a fence for her farm. Oh no, it looks like she just got a splinter. She just pulled it out and got back to work. Meanwhile, her immune system is starting to get to work on defending her body. Let's see what happens in the body in response to getting a splinter.
The body is covered with millions of bacteria, but they are harmless on the outside, separated from the inside by skin, which is the first line of defense. When the splinter pierces through Rachel's skin, an opening forms for the bacteria to enter into her body. To destroy the bacterial invasion, the body undergoes an inflammatory response. The inflammatory process begins with a chemical alarm. When cells are injured, they release inflammatory chemicals, including histamine and kinins. These chemicals cause blood vessels in the area to dilate and capillaries to become leaky. They also activate pain receptors, which causes Rachel to stop working on the fence. The chemicals also attract phagocytes and white blood cells to the area, a phenomenon known as chemotaxis. Dilation of the blood vessels increases the blood flow to the area, resulting in redness and heat, both of which are two of the four cardinal signs of an acute inflammation. Increased permeability of the capillaries allows plasma to leak from the blood into the tissue spaces, causing local swelling, which activates pain receptors in the area. Swelling and pain are the other two of the cardinal signs. The inflammatory response prevents the spread of damaging agents to nearby tissues, disposes of cell debris and pathogens, and sets the stage for repair. Let's look at how it accomplishes these tasks. Within an hour or so after the inflammatory process has begun, neutrophils are squeezed through the capillary walls in a process called diapetesis. Drawn to the area by inflammatory chemicals, the neutrophils begin the cleanup by engulfing damaged or dead tissue cells and or pathogens through phagocytosis. Monocytes also leave the blood and follow the neutrophils to the inflamed area. Monocytes are fairly poor phagocytes, but within 8 to 12 hours after entering the tissues, they become macrophages. The macrophages continue to wage the battle, replacing the short-lived neutrophils on the battlefield. Macrophages are the central actors in the final disposal of cell debris as the inflammation subsides. Clotting proteins leaked into the area from the blood are activated and begin to wall off the damaged area with fibrin to prevent the spread of pathogens or harmful agents to neighboring tissues. The fibrin mesh also forms a scaffolding for permanent repair. The local heat increases the metabolic rate of the tissue cells, speeding up their defensive actions and repair processes. The phagocytes continue to remove the pathogens until the area is clear and ready to heal.